So welcome back to the information day of Cluster 1. We will now continue with some cross-cutting issues which are particularly important for this cluster. I hope that you've already seen the different presentations on the website and posted your questions in Slido. This is important so that we can actually answer your questions. And I would now like to present my colleagues who are joining the cross-cutting session and who will help to answer your questions. So perhaps we can start with Isabel Vergara, who is not on my picture at the moment. So then we will start with Anne Pepin from RTD-D4, who will be responsible for answering your questions on the gender equality provisions.
Good morning.
Then we have Katrine Romans-Notteglu from RTD-F1, who will be responsible for the international collaboration. And there will already be a presentation available on the website, which is a little bit more elaborate than the one that Katrine is going to give in a minute. Then there's Pilar González Pantaleón from RTD-D3, and she will answer your questions on social science and humanities. Then there's Ulrich Genschel, who's also not on my screen right now, but there's a recording on the website that will explain all the things. And finally, there's Jan Pehler from RTD-D1, who is responsible for the clinical studies, and he will now give a short presentation about the clinical studies. So Jan, please, the floor is yours.
Yeah, thanks a lot, Søren. And I want to introduce the clinical study template and basically also refer to the importance that this work program yet again gives to supporting clinical studies, and that we want to make sure that they are efficiently implemented and effective and have high impact. So with the next slide, we can see that the clinical studies are usually very complex, but the types of challenges are well known and can be addressed with meticulous planning and the necessary resources to invest. So that's why it's important both to have the intelligence, the knowledge, the awareness, but also the resources and a plan how to overcome these challenges. And a meticulous plan should cover not only the design phase, but run all the way through the end to report resulting and cover everything. And to facilitate both the planning and the review of the proposals for clinical studies, we have developed a template that you will find and need to submit for any clinical studies that you're proposing. And the guidelines, the template makes very clear that we're looking not only for scientific excellence, but also for operational feasibility, how to implement them. And the template also, by asking for structured information, gives a lot of help to the reviewers to then give a fair assessment of the study proposal, particularly the robustness of the various aspects and the required planning. So the ultimate goal, of course, needs to be that clinical studies are efficiently implemented and deliver impact. Next slide. So what is a clinical study? And there is no universally accepted definition. That's why we defined it very broad to bring in scope all studies, whether studies, trials, investigations, cohorts, and ask for structured information. And the purpose being so that any systematic collection and analysis of health data, whether it's prospective or retrospective, of individual patients or healthy individuals in order to address the scientific questions that may cover the understanding, the prevention, diagnosis, monitoring, or treatment of a disease, mental illness, or a physical condition. So, and that covers all health technologies and interventions. And so certainly, of course, the medicinal products covered under the clinical trials regulation, or the medical devices or in vitro diagnostics on medical devices, but also surgical interventions or health counseling, for example. So the topics where this template and additional structured information is requested are clearly marked and referred to the template that will be available. The template itself includes more information and guiding questions on how to provide the information. And on top of that, my colleague Laszlo Helmle has initiated a presentation on YouTube, which we recommend you look at, that gives detailed information on the use and the completion of the template. So thanks a lot.
Thank you very much, Jan, for this short refresher on clinical studies. And now we will go on to Pilar for the presentation on social science and humanities. Pilar, please.
Thank you, Søren. Hello, everyone. The integration of social sciences and humanities, what we call in short SSH, started already in Horizon 2020 as a new approach in the EU Research Framework Programme. One of the reasons behind this approach is the realization that our societal challenges are far too complex for only one discipline or a group of disciplines to deliver on. In general terms, SSH plays a key role in analyzing and influencing behavioral and societal choices. Therefore, the integration of social sciences and humanities in research aims to deliver better policies with a direct societal impact in the future. And this is how SSH has become a cross-cutting issue across all research and innovation areas of Horizon Europe. Next slide, please. The legal framework for the integration of SSH is set under Article 7 of the regulation establishing Horizon Europe, where it is indicated that Horizon Europe has to ensure a multidisciplinary approach, and where appropriate, it has to provide for the integration of SSH across all clusters and activities. Moreover, the specific program implementing Horizon Europe highlights as one of the operational objectives of the Research Framework Programme the need to increase collaboration links in European research and innovation, and also to increase the collaboration across sectors and disciplines, including social sciences and humanities. Some examples of SSH disciplines are sociology, demography, political science, psychology, human rights, education, journalism, law, public administration, history, religion, theology, ethics, etc. Next slide, please. In order to promote the integration of social sciences and humanities, some topics had been flagged as SSH. This means that these topics are particularly suitable for the integration of SSH. Moreover, in the present work program, a specific sentence has been included in the SSH flag topics to make it more visible. This sentence refers to the need of having an effective contribution of SSH disciplines and the involvement of SSH experts, institutions, and any relevant SSH expertise, all with the aim to produce meaningful results that increase the societal impact of research. For this reason, when preparing a proposal for a topic that has been flagged as an SSH topic, the applicants need to pay particular attention to all related SSH aspects and show the role of SSH disciplines in the proposal. It may happen that an applicant considers that the integration of SSH is not appropriate for their proposal. In this case, the applicant needs to justify very well why the SSH component is not relevant for their proposal. During the evaluation, the evaluators will assess the justification provided by the applicants. For those topics flagged as SSH, SSH is a requirement that will be assessed under each of the evaluation criteria. During the evaluation, there will be evaluators with expertise in SSH taking care of the SSH part of the proposal. They will assess how well the applicants have integrated the SSH dimension in their proposal. In Criterion 1, Excellence, they will check if the role of SSH disciplines is properly addressed. Under Criterion 2, Impact, they will assess if the proposed dissemination, exploitation, and communication measures are suitable. And under Criterion 3, Implementation, they will consider two aspects. First, if the consortium matches the project's objectives and brings the necessary disciplinary and interdisciplinary knowledge. And second, if the consortium includes an effective expertise in social sciences and humanities. If these elements are sufficiently addressed, scores for these criteria should be higher. You can find more information on the practical evaluation of social sciences and humanities in Horizon Europe proposals in the Funding and Tender Opportunities portal under the support videos on Horizon Europe. You will find a 5-minute webinar on how to evaluate social science and humanities in Horizon Europe proposals, and it can be really useful for you when preparing your proposal. Thank you. I will pass now the floor to Anne.
Thank you very much, Pilar. So I will give you a refresher on the different levels of gender equality provisions that are strengthened in Horizon Europe compared to Horizon 2020. Next slide, please. So there are three levels. So the gender equality plan is an eligibility criterion for certain categories of legal entities, higher education establishments, research organizations, and public bodies from member state and associated countries. And you have a full webinar on the topic that details all the different aspects of this eligibility criterion. You have the link on the info page of this event. So I will not go into the details, but you have some links here as well. I will give you a little bit more information on the two other levels. The fact that it's mandatory as part of the award criteria to integrate the gender dimension into the contents of research and innovation projects, and that gender balance among research teams is a ranking criterion for proposal with the same score. Next slide, please. So integration of the gender dimension in research and innovation content. Next slide. So indeed, that's part of the methodology that is under the excellence criterion for research and innovation actions and innovation actions. Next slide, please. So this is mandatory across all REA and EA topics in Cluster 1, specifically in this 2023-2024 work program. So this means taking into account potential sex differences or gender differences. And if you can go beyond looking at intersections between gender, sex and gender and other dimensions and potential grounds for discrimination or social categories such as ethnicity, sexual orientation, disability, these aspects, that's also welcome. But what is mandatory here is really taking sex, so biological attributes that are related to genetics, hormones, physiology, anatomy, as well as potential gender differences, so norms, related to norms, to gender identities, and to gender relations. If these, take those as variables in your topic and try to strive for promoting gender equality for all through this research and innovation action or innovation action. So next slide, please. I think this is pretty obvious that it's important to take these aspects into account in cluster 1. Just as for the SSH criterion that was presented earlier, if you really think that in your topic it is not relevant to look at sex and or gender as variables, you will need to justify why in your application. So here you have a lot of resource material, especially a policy report that we released in 2020 with a set of case studies that are developed in particular for the health domain. So there's a case study on prescription drugs, on chronic pain, on systems biology, and even some field-specific methods. So how to analyze sex in tissues and cells, how to analyze sex in lab animal research, sex in biomedicine, and gender aspects also in health and biomedicine. So you have many resources there. You may know as well that it's now a requirement for the Nature journals to actually look into sex and gender in the research that is submitted to these journals. And you have additional links there that can help you in looking at a little bit more in detail at what you can do in your specific topic. Next slide, please. Then gender balance in research team. Next slide. So that's a ranking criterion. It's based on the named researcher in the researcher table in the application, and it comes after 2 other ranking criterion, so covering everything that's in the topic description, and then the scores on excellence, and then impact, and it's the reverse if it's an innovation action. Next slide. One novelty that I need to underline as well, you see here the researcher table that you have in the applications. Now, researchers can self-declare their gender along 3 gender identity categories: women, men, and non-binary. And I will stop here. Just maybe next slide. Just some useful resources. If you want more information, next slide. You have the link here to our website, and I'll be happy to take any question on any of those gender equality provision. Thank you.
Thank you very much, Anne, for a very enthusiastic presentation, I think. We are now ready after all the recordings and short presentations, and we will move on to your questions, which I hope that you've already posted in Slido. We should have approximately 30 minutes to answer your questions until we have a short break. But let's start with the first question.
So I guess this is for me.
Yes, please. Perhaps
yes.
I can say it, and then you can answer, just so that we are sure that everyone is aware. So
Okay.
Do all partners need a gender equality plan, or is it only the coordinator? Please, Anne.
It's all partners in a proposal if they are under one of the 3 legal entity categories. So a higher education establishment, a research organization, and that means performing organization for the Commission, and or a public body from a member state or an associated country.
There is a follow-up plan or follow-up question on that one. It says in the next question, when is the gender equality plan needed? At proposal stage, or at proposal submission, or grant agreement preparation stage?
It will be checked by executive agencies at the grant agreement preparation stage. So if you don't have a gender equality plan, if a partner in your proposal doesn't have a gender equality plan at submission stage, it will not block the submission. It will not be considered in the evaluation, so it will not block the evaluation of the proposal, but we do recommend that you really develop your gender equality plan, a compliant one, as soon as possible, in order to avoid that you be blocked at grant agreement preparation stage and that you delay the time to grant.
Thank you very much, Anne. It is indeed a very important issue, and it has been the cause of delays for several projects in the first couple of years of the framework program. Let's move on to the next question. Does one have to fill in a clinical study template for population-based cohorts or historical studies? I guess that's for Anne, for Jan.
Yes, the answer is yes. So if there are patient level data that you are reviewing, then the submission of the template will be necessary. And also, if I may go to the next question that is related, if there are several clinical studies, you don't need to fill a template for each, but can integrate the information in one template. So we're only looking for submission of one template per proposal. But in this template, the information for each of the clinical studies that you're proposing need to be provided.
Thank you, Jan. I think the next question is also for you. Are there any study types that will not need a clinical study description? Like, for instance, observational ergonomic studies, interview studies, or similar?
Well, yeah, again, the definition is very broad, and the aim is to give the reviewers as much structured information to make a thorough assessment. So that's the ambition. So whenever, and please go again to the very broad definition that is in the work program on page 4. That describes the broad scope of how we understand clinical studies. And yes, they seem to be included.
Then there is the next question. Do all clinical centers involved in the project need to be project beneficiaries, or are there other ways to involve them? Do we have an answer on that? Jan, seems you're...
It's for me?
Yes, I think so.
Well, this is about the contracting. No, but I don't think they need to be project beneficiaries if there are can be contracts or if they can be linked to a beneficiary. Yeah. So they do not need to be.
No, I think that they can be third parties or they can be subcontractors in principle, as long as not the majority of the actual work. Anybody can confirm this? I think that's the case.
I can maybe just add one thing, one element. If this center is a third party, in principle, it will not participate as a third country entity, then it will not participate as a beneficiary, but as an associated partner not receiving EU funding and nor signing the grant agreement.
Thank you very much, Katrien. Then there is a question from Deidre on the environment health intervention. Is the clinical template required for interventions targeting worker psych, well-being? I'm not sure I understand fully. No clinical MH diagnosis. Do you know, Jan?
Yeah, well, but we would have to discuss it in the topic. But if the topic suggests that clinical studies are supported, and this looks like a clinical study to me, then the template will need to be submitted.
Okay, very good. Then let's move on to another question, the blind evaluations, which is a new feature in our work program. Isabel, how do we describe the previous projects and work if one is not allowed to name organizations?
Yes, hello, good morning to all. Actually, we don't ask these details in the first stage evaluation. So remember that blind evaluations are carried out in the first stage only of 2 stages calls. And in the first stage, we only ask for an outline of the proposal, and the details of the previous experience of the participants is not asked in the first stage.
Okay, thank you very much, Isabel. Then a question on social science and humanities. Do the SSH experts have to be scientists, or can they be, for instance, SEMs applying SSH expertise in certain contexts? I'm not really sure what SEMs is.
I suppose it means STEAM.
Maybe SME and SB could be.
Yeah, it could. It seems like that it would be SMEs.
An SME.
Otherwise, I don't understand the question. That's for sure. So.
Okay. Well, if they are applying SSH expertise, it could be accepted. If they are already working on it, if they are I don't know, an SME working on SSH, then I think it can be accepted.
I guess that anyone who has a certain expertise can participate as an expert in the framework program. So in that case, the answer would be yes. So there's another one for gender equality. Is the gender equality mandatory also for hospitals? Do you know, Anne?
Sorry, I couldn't unmute myself. If these hospitals are public bodies, yes. So for all public bodies in member state and associated countries, indeed.
Okay.
With the 4 mandatory requirements, of course.
Thank you very much, Anne. So there's another social science and humanities question. What SSH disciplines are typical in health projects? Could you explain that, Pilar?
Yes. For example, looking at the monitoring report of the 2018 projects that were selected and that they included SSH partners, the most common partners in health projects were political science, public administrations, economics, sociology, business, marketing, law, psychology, communication, anthropology, ethnology, humanities, the arts, education, and demography. These are the most common in health.
That's perfect. Thanks a lot, Pilar. Then there is another question on the clinical studies template. Is the clinical studies template different for the calls in 2023 as it was in 2022? That's for Jan.
Yes, it's essentially the same. There have been some editorial changes, like adding reference to the EDCTP joint undertaking, but nothing substantial in changes.
Okay, very good. Then there's another one on blind evaluation, I think, or it's at least related to blind evaluation, when our activity is very innovative and atypical. Now that question disappeared, from my screen at least.
I didn't hear the question, so I think I can't answer.
It disappeared before I could actually read it out. So Okay, we will go to another question, then perhaps it will be posted later on again. There's an anonymous question regarding gender balance in the overall proposal. How is a female-male ratio over 1 considered? Is the prevalence of female scholars appreciated or discouraged?
We're looking for gender balance, so close as possible to 50% is that's what we're aiming for. So it's not about having the proposal having the more women will not be ranked higher than the one that has a 50% ratio.
Very good. I guess we are looking for balance in our proposals. So no
Indeed.
proposals with 100% men or women. Good. Then the next question is actually the one that I started giving to Isabel, but which was then lost in translation. So now it's coming out again. When our activity is very innovative and atypical, the blind application is hard to keep blind, since only one company is doing that. How do we do in this case?
Yes, we know, and this is exactly the reason we are organizing only a pilot, and we are just testing how we can manage these specific cases. So from your side, you don't need to be worried about. You just draft your proposal Part B without identifying the applicants. And then, yes, we are aware that in areas where there are only a few companies or organizations working in a subject, it will be easy for the experts to guess who is behind. But in these cases, you will not be penalized, but it's something that we will analyze later on in the pilot. Yeah.
Okay, thank you very much, Isabel. I'm also looking forward to see how it works in the program with the blind evaluation. So then there is a question about Hungarian universities. And this is a legitimate question, but I cannot answer, or we cannot answer that right now, because our colleagues are actually working on guidelines for this, as it's a new occurrence. So therefore, please write to the Research Inquiry Service to ask for this, and then we will make sure that there is also the guidelines which are posted on the research website later on. And the question which is now highlighted on my screen has already been answered, and this one has as well. So the next one would be, can you give some examples of what SSH could typically contribute to in a R&D in a proposal? Pilar, do you understand the question?
Yes, I think in a proposal, for example, let's take an example on mental health, on burnout. I think having partners also from the social science and humanities can really be an important asset for the project, because they will be looking at the social aspects, at economic aspects, many aspects that will be influencing on this situation, why this is happening, and also for finding the solutions, that this is even more important. So I think it's really important, and for the proposal to involve the partners already from the beginning, and include these partners in SSH, because they will give an added value that otherwise you will not get it. I think this, well, for example, for mental health projects, but for many others as well.
Thank you very much, Pilar. Then there is a question about the best method to find partners for a proposal. I don't know if anybody could answer that. I guess, Isabel, you've been around for quite some time doing things like that as well. So would you mind trying?
I'll try, yes. No, but on this, I probably want to mention that we have a service in the portal in which you can find partners in a specific area and that are willing to collaborate in projects. Yeah. But apart from this, as a researcher, so it's just you just need to have in mind what you want to build in your proposal, the expertise you need, and then yeah, search for the best organizations in these areas. Yeah, apart from that, I don't know. Maybe,
Thank you very much, Isabel.
Yes.
I think that in addition to the ones that were mentioned by Isabel here, by using the partner search facility on the web, I would also recommend people to go to the brokerage events, not only the European ones, but also the national ones, to make sure that you can present yourself and be involved in the proposals or in the activities which are of importance for you. Researcher table. There's a question about a researcher table. Should you mention people here you do not yet know or plan to hire?
I can take this, Sharon.
Yeah, okay, thank you very much, Isabel.
Yes, no, you should not mention people that you don't know for sure that is not going to work for the project. So at the time of the proposal, we want you to mention only those that are really involved at that time. Later on, if the proposal is funded, then you will be able to update this researchers table at any moment during GAP, the grant agreement preparation, and also through the continuous reporting. But at the proposal stage, you should just put the names that you are sure are working in the proposal.
Yeah. So no guessing in proposals. Also, the experts, they don't like to guess. This question we already answered. So is there any questions left in our session? Okay. So this seems not to be the case. In that case, does anybody want to say something about, for instance, international collaboration? I think that it's one of the most common issues that we have in the cross-cutting issues, and it's something that many people are actually answering about or asking about. Could you say something about that, Catherine?
Yes, I can say, for example, a question that we receive very often is if third countries also receive EU funding, and this depends. As a default, the program is open for third countries, to most third countries to participate in the program, but that doesn't mean that they are also automatically eligible for funding. This difference is very important to make. So third countries that are eligible for funding are the low and middle income countries, for example, but other third countries, they come most of the time with their own funding when they participate in collaborative projects, for example, and then they are considered as associated partners and not beneficiaries. In this case, they do not sign the grant agreement neither. But for cluster 1, there are also exceptions. For example, you will see that in the description of certain calls, the US is explicitly mentioned as a third country that receives, that can participate with EU funding. When there is an exception on this general rule, it's always very well mentioned in the call topic descriptions, and so it's to be find there the answer if there is funding or not. But it's open for participation and sometimes also for EU funding.
Thank you very much, Catherine. I think the next question is also for you. It says, what is the status of the association agreement with New Zealand and Australia?
This is in progress, of course, and the colleagues in the association unit they are working and progressing on it really well. But as long as this is not finalized, they will be considered as third country partners.
This is indeed a very exciting issue for us right now, because there are many that are aspiring to become associated partners, and we hope that we will see some new countries in there. I think the question on the third countries that receive EU funding, we have already answered. Is there any of the other people that would like to ask questions about cross-cutting issues? Now is the chance that you have, because many of the other sessions will mainly be discussing the issues that are dealing directly with the different destinations. Otherwise, you would have to go and revisit the videos and the recordings of this session. So there was one coming up. Is the participation of low and middle income countries positively evaluated in the proposal evaluation? Could you explain that, Catherine?
When it is not an eligibility criteria, it is not in particular considered in the evaluation process as positive or negative. Yeah.
So neither positive or negative.
No, it's just if it's not an eligibility criteria or or not mentioned specifically that cooperation with lower middle income countries is recommended or required, then it is not in particular taken into account.
Okay, thank you very much, Catherine. Then there's a question from Hela. When a disease is predominant in women and rare in men, is there a procedure to follow not to be downgraded?
Well, you need to justify that, building on research evidence to explain why you would not be considering one of the sexes or genders in your project.
I think in general we can say that in the proposal you always have to argue your case. You cannot imply that certain things are happening. You have to argue why it is like this. Even if there is a requirement in a proposal that is there and you cannot fulfill it, then you have to say why you're not doing it, not just leave it out.
Mm-hmm.
Okay, then a question about UK collaboration, which now disappeared. Are UK registered NGOs still eligible to apply for funding? Catherine?
I am not a specialist in UK. This is not in our unit, but they have still this special status, a transition status that up to the moment of the grant agreement that it needs to be signed, if they are still not associated, then until the point that the grant is signed, they are treated in this transitional but if by that time the association is still not effective, then they will be treated as a third country. So they will not receive EU funding.
Indeed.
Sorry, maybe I can complement.
Yeah,
so
thank you.
They are still considered as to be associated countries.
Yes.
So for the evaluation purposes, they will be considered as associated country. But if the association agreement is not signed by the time to grant arrives, then they will have to become associated partners. Or so it's to be discussed case by case. Yeah.
Okay. Very good. Thanks for the addition, Isabel. Then there's a question from Estefania. Will the UK sign the grant agreement if a project is granted? And should we include UK budgeted in the total estimated EU budget requested? Can anybody answer that?
Well, I can also give it a try. No, it's what we replied before. So for evaluation, UK participants are still considered to be associated, so they will not be rejected because not eligible for funding. And so they can be participate in a proposal as beneficiary with funding, etc. But if the proposal is retained for funding and if we reach the time to grant and the association agreement with UK is not yet signed, then the UK participants will have to find the budget from another source and become an associated partner that is part of the project, but they don't sign the grant agreement. This is one option. Another option, as I discussed, is case-by-case decision, could be replacements of these participants, so discussion case by case. Yeah.
Thank you very much, Isabel. I guess we cannot guarantee that the UK will sign the grant agreement because that's not in our mandate. Then there is a question from Anonymous. Should countries from different regions of Europe be considered? Is this a must? I'm not sure I understand the question. Do you, Katrin?
I don't understand about from the question if it's about non-EU countries or not. If it's regions in Europe,
No, I'm also not sure. Perhaps the question can be updated to make sure that we better understand what we would have to answer here. Then we go back to social science and humanities. Who counts as SSH expert? How about interdisciplinary experts that deal exactly with these questions? For instance, human-computer interaction researchers. Pilar, do you have an answer on that?
Yes, well, SSH expert will be on the different disciplines, SSH disciplines, social science and humanities, but it may happen that you can have also SSH expertise by your work, by your activities, so you can always put that in the proposal and see. But everything will be considered with regard to other proposals. So you really need to justify very well if you consider that this is SSH expertise.
Indeed. Then let's go to the next question. An Australian entity can participate without EU funding, but with NHMRC funding, that means Australian funding. I guess that's the case, isn't it, Katrin?
yes, any third country can come with any funding that he wants or can find in his own country. It's true that Australia has certain co-funding mechanisms put in place to support their entities financially in order to participate in Horizon Europe. So this is definitely the case. Yeah.
Okay, thank you very much. So the next question is it compulsory to have a specific partner dedicated to social science and humanities, or is it possible that within one partner a strong expertise in SSH involved in the project is included?
Well, this is up to you to decide, but you just have to justify how you will do it, because you know that you will be evaluated. So justify it as best as you can. If you consider that this SSH expertise within one partner is already enough, but it's up to you.
Then there is an interesting question here, which is a little bit different from the ones we usually get. If somebody received funding as a co-applicant but changed institutions afterwards, do they have any right to at least a part of the funding? Can we answer that?
Maybe I can give it a try. Not the funding and the participants are the entities, so we don't give money to persons. So I'm not talking about the ERC. The European Research Council is different. So we are talking in cluster 1. So the funding is given to organizations, not to persons. Yeah.
In essence, it's an issue that HADEA is dealing with quite often. I have to say, when people are changing inside institutions, and they have been part of writing the proposal. So this is actually an important issue. Then a popular one: can you participate in several proposals for the same topic? Does anybody want to have a go at that one? If not, then I can tell you that yes, you can participate in several topics or several proposals in the same topic. Many people do that, but they have to make sure that their activities are not overlapping, so that we do not, or we will check for double funding in the proposal that go through, and therefore this is important to make sure that there is no overlap. Then we can go to the next question. And I think that's the clarification of the question we had before, which we didn't really understand. Is there any requirement regarding the consortium composition, region composition, Western, Southern, and Eastern Europe? Catherine, could you elaborate on that one?
Maybe I can, Soren. Yeah.
Okay.
No, there is no any requirement. So it's just the eligibility criteria are 3 different countries. Yeah, and this is the requirement. So there are no other requirements related to regions or parts of Europe. Yeah. If it is not specifically written in the call, yeah, of course.
Okay, thank you very much. Again, it goes, we need to have a balanced proposal on expertise and countries, but not from not necessarily from specific regions. So what does it mean for health with the extension of the UK coverage of Horizon Europe projects until the end of March only? Does anybody have an answer to this question? I think this is not something we can answer, because we are not responsible for the UK government actions. So whatever they decide on these issues, whether they will contribute to the Horizon Europe project or not, that's up to them. So the next one, which is highlighted, is any specific requirements or extra rulings for private companies or startup participation in the consortium? Can anyone answer this? I don't think that there...
I don't see any, yeah. So.
Please, Isabel.
No, I wanted to answer that we don't have specific requirements for
no, exactly.
different type of entities. Yes.
Yeah. I'm actually surprised that there are no questions about lump sum for Ulrich. No questions about lump sum funding. This is all clear. That means Ulrich and his team has done a wonderful job of explaining how that works.
Well, and as far as I know, lump sum funding is only going to be used in Cluster 1 from 2024. So the calls that are currently open, to my knowledge, are not using lump sum funding in Cluster 1. So that may also be a reason, and we may come back in a year's time and then answer your questions.
Thank you very much, Ulrich. Then we will probably take the questions in the next round of the information days. I think we're going to the last questions now. And the one that we just had on the screen right now, which is highlighted, we already answered. We will refer people to the Research Inquiry Service. So we take the last one here. Can UK entities be coordinators in a Horizon Europe proposal during this transition stage? And what are the directions then at the grant agreement preparation stage? can we answer that one?
Maybe I can try. Yes, in the proposal, they can be coordinators because they will be considered still to be associated. So with any other, the rules as any other member states or associated partners, the same rules. But as I said, if the proposal is retained and we reach the time to grant and the association agreement is not yet signed, then they cannot be coordinators. If they become associated partners cannot be coordinators. So then in that case, there has to be a change of coordinators.
Thank you very much, Isabel. It's actually a very important question because we had quite a number of these cases already in the last 2 years of the framework program. So any last questions? If not, then I think we will conclude the session right now. I would like to thank you for your attention and the interesting questions that were posed. And I would also like to thank my colleagues for providing the answers, also to questions that were sometimes a little bit surprising. So the one last thing I would like to say is please don't forget to go to the frequently asked questions and consult these so that you know exactly what is the issue for your proposal. And also to use your NCP, your national contact point, is really an important partner for you. They are there for you and have a knowledge which is locally based. So now we will have a short break until 11 o'clock when Irina Calderon-Libel from DG Connect will come on and be the moderator for the Destination 1. With that, I would like to thank you for your attention. Bye.